It's not a catch-all diagnosis that people used to think that that was the case. Oh, the doctors don't know what's wrong with me, they'll call it IBS. In fact, it's so not that, at least in my practice, and I'm sure the vast majority of the gastroenterologists do not practice this as a catch-all diagnosis because we have strict criteria to diagnose it. So the criteria to diagnose IBS are based on Rome 4 criteria, which is the diagnostic criteria, the society that puts together the criteria for the brain-gut interaction disorder. So for you to be diagnosed with IBS, you have 3 different subtypes. You have the diarrhea subtype, the constipation one, and the mixed, where you kind of alternate between one and the other. You have to have abdominal pain that is lasting for at least 3 months and happening 2 or more times per week. And it has to be associated with a change in your bowel movements, whether that is a frequency change, texture or appearance of the stool. And also the pain usually modifies or changes with the bowel movement. Our previous criteria used to say that we had improvement in the pain once you had the bowel movement, but our most updated criteria says that you can have any type of change in your bowel movement. So with the bowel movements and the pain, so it can even get worse after you poop, unfortunately.
How long do you think on average it takes for folks to get the diagnosis?
I think probably longer to get an official diagnosis, longer than the ideal time. I would say the majority of people who come to my office that end up with a diagnosis of IBS is they have been struggling with this for years. And they usually start the line saying, I always had a sensitive stomach, or I know that I cannot eat like everyone else, otherwise I'll pay the price. Or a common thing is that my whole family is like that, or my dad, I got my dad's gut or my mom's gut, and I have the same kind of issues. And at some point, usually it starts in early adulthood or sometimes in the teenage years. Majority of people are diagnosed before they turn 40.
And is it more common in men or women?
It's slightly more common in women, yes.
And can it affect all races and ethnicities?
Yes, pretty much. We used to think, or we used to label this, not necessarily the scientific community, but in general, was a disease of more affluent women, and that's not the case at all.
No, so it's really good to keep talking about it to raise awareness.
Absolutely.
So would folks mostly start describing their symptoms to their PCP, and then they would get referred on to a gastroenterologist?
Yes, a lot of folks are diagnosed officially by their primary care provider. If they have trouble treating them, or if the patient requests an appointment to confirm the diagnosis, then they will be referred to the GI doctor.
And you mentioned the different subtypes. Can
Yes.
people change subtypes throughout their lifespan?
Yes, they can. The majority of people will vary between one of the types, either the diarrhea and the constipation. And if they have a change in their bowel habits, they're usually going to go to the mixed subtype. It's uncommon for people to go from the diarrhea to the constipation right away. In fact, if that happens, usually we consider that an alarming feature. A big change in the bowel habits is a reason to be concerned and a reason to have an investigation done.
So it's really important to talk to a physician to make sure no red flags are missed and to get a real accurate diagnosis.
Correct. So
I was recording.